What is capsular contracture after breast augmentation? Whenever we put a breast implant in, the body forms a lining around the implant as their biological response to healing. That lining is called a capsule. It's normal, happens 100% of the time. But in certain cases, that lining can thicken, the capsule can thicken, and that's called capsular contracture. It can change the shape of the breast, it can be uncomfortable, sometimes painful, and what do we do about it? Well, when a patient has first-time capsular contracture in one breast, conventional present-day treatment is to take out the implant, take out that lining, the so-called capsulectomy, and put in a new implant. If the patient presents with capsular contracture in both breasts, otherwise known as bilateral capsular contracture, the incidence of recurrence with that conventional treatment of capsulectomy and implant exchange is quite high, on the order of 40% or so. In that instance, we will put in something called a cellular dermal matrix. And let me explain about that. We commonly put implants, our breast implants, underneath the pectoralis major muscle. We will put a cellular dermal matrix so that to the lower edge of the pectoralis muscle and the inframammary fold. You can see it on side view. By doing that, we reduce the risk of capsular contracture from that high number of 40%, 50%, down to less than 5%.